Hi Mama! Welcome to this video. I'm Katie. Today I'm 23 weeks pregnant, and in this video we're going to talk about the development that is happening in baby, as well as the symptoms of pregnancy that you might be experiencing and what is going on in your body and how to help you. Let's start with baby. So our baby is around 28 to 30 centimeters long and weighs around 450 to 500 grams. And if we compare it to a fruit, it is the size of a mango. I weighed this mango. This one is 600 grams. So a bit heavier, but not a lot heavier actually. So this is more or less the size of the baby that is in our bellies now. Super exciting things are happening. Baby's brain is developing really fast. All the senses are developing. The baby can taste the amniotic fluid, so they have taste buds developing, which means it's super important what you are eating. So have a varied diet, eat various things, different tastes, different flavors if you can, different cuisines even, to get all those flavors into the amniotic fluid and then into the little mouth of baby, so he or she can start tasting what you are tasting. And this will help in the future to prevent a picky eater, and starting solids will be easier. So go ahead and vary your diet, Mama. The sense of touch is developing. So baby is moving a lot. You're going to feel the baby move, kick, stretch. Actually, it's quite nice to picture. You can have this little mango moving around. Because it's so small, it can move so much. And through the movement, it is touching things around them, so it can grab the umbilical cord by accident. It might be kicking you or punching you, touching its own body as well. So it is feeling everything around them and experiencing the inside of the womb. Your baby can hear pretty well now. 23-week-old babies can hear internal and external sounds. So the internal ones are all this whooshing, gushing, the blood, the digestive system, you talking as well from the outside, and baby can start recognizing sounds that they hear often. So mama's voice, maybe daddy's voice, maybe a sibling's voice. So you can definitely have little conversations with your baby now because they are listening at all times. Their eyes are now fully developed, but they are fused shut and they will not open until baby comes out and joins us in this world. But the eye pigmentation is developing, which means that the color of the eyes is starting, the eyes are starting to get color. Another really cool thing is that potentially around 23, 27 weeks, your baby could start getting hiccups. And this is quite a sensation. You're going to feel this kind of jerks in your body, in your belly, because when a baby gets hiccups, the whole body is going to jerk and move, and you will feel that as well. I felt it the other day, and yeah, it was very cute. The lungs are also developing, although they won't be used until baby comes out into this world as well. So a lot happening with our little mangoes. Let's talk about us now. So the belly's growing, baby's growing, we are growing, which means that you might experience backaches and pelvic pressure. So it is advised to train the pelvic floor through doing Kegels. And I have a separate video on Kegels, so check out the description box below to go to that video and practice Kegels with me. It's important to do that daily for a minimum of around 5 minutes. So it is supposed to be a workout, not 2-3 little Kegels here and there, but like continuously do a pelvic floor training for around 5 minutes, and that will strengthen your pelvic floor. For the backaches, the stretching and the strengthening is super important. So everything that we do in this great pregnancy journey and the pregnancy challenge. So join me for the workout videos and stay fit with me in pregnancy. You might be feeling Braxton Hicks. So these are contractions of the belly. They should be painless at this point in time, and they're just your body preparing and practicing contractions already now for the birthing process, which will come still in many weeks to come, but your body's already practicing now. You could experience them if you've worked out too much too hard, so be careful, don't do that. And you might experience them if you are dehydrated and you're not hydrating enough, not drinking enough water. So make sure to train accordingly to what your body needs and what your body permits. And definitely drink a lot of water. Hydration is key. You might also be experiencing mild swelling in your hands and in your feet, as well as in your ankles. So again, hydration is super important to help with this. Don't stand in one position for too long. Don't even actually sit in one position for too long. Movement is key. So if you are sitting, the best position or the best thing to sit on is a birth ball and an exercise Pilates ball. Sometimes we use this ball in the videos as well. So this big bouncy ball, which essentially makes you keep doing these minor movements, as well as you can bounce on it gently, and that helps. You could also elevate your legs, and if it's hot, you can also cool them down in just cold water. What else? You might experience increased vaginal discharge, and this is completely normal if it is kind of this white milky color. That is completely fine, and if it doesn't smell bad. If it starts smelling bad and starts to get itchy, then please go and see a specialist to check out if there are some bacteria, if you have some sort of infection. Heartburn and indigestion are normal at this stage. That's because everything is pressing now on our organs. What should we do to prevent heartburn is eat smaller meals, avoid spicy foods, avoid acidic foods, and don't lie down immediately after having eaten. Leg cramps is something that could be happening as well, especially during the night and especially in your calves. So this is something that I am getting. So how do we prevent this? Again, it's hydration, again, it's stretching, and also taking a magnesium. So when I do take magnesium, a rather large dose of magnesium, around 300-400 milligrams, then the cramps don't happen. And I take this before, around about an hour before going to bed, and that definitely does help. So if you have cramps, ask your doctor if you can take magnesium and start supplementing that as well. You might be seeing some skin changes. So potentially the linea negra is starting to appear, which is this black line from your belly button down. Your nipples might be darker as well as you might be seeing some changes in pigmentation on your face. So nothing you can do really about the linea negra, and it's a completely normal thing. Nothing you can do about the changing colors of the nipples. This is so that baby, when they are born, their eyesight is really underdeveloped. So they'll only recognize slightly the differences between contrasting pictures, so black and white, and therefore if you are a white person, your nipples will be much darker, and this helps the baby to latch on to start drinking milk. When it comes to the pigmentation changes on your face, make sure you apply a big dose of sunscreen every day before going out. Sun is really dangerous, and it can really harm our skin at this stage because it is so sensitive. And there's one more thing that you might be experiencing, which are the mood swings, emotional changes, anxiety. This is normal. Just hang in there. If this is something you can't cope with, however, do please see a specialist to talk about it. What is important? It's important to rest. It's important to take care of yourself. It's important to eat well and drink a lot, and make sure that your needs are met, because you're not just meeting your needs, you're also meeting your growing baby's needs, and their needs are massive at the moment. So that's it for today. Thank you for joining me in this video, and I hope to see you in a workout video. Let's work out together. Let's stay fit together. 23 weeks. We're more than halfway there. Let's stay fit, happy in pregnancy together. All the best in the meantime, and subscribe to my channel to support me. Thank you, and have a good day. Bye.